Seniors, these three drug combos make arthritis worse. Are you at risk? Senior health tips. Imagine this, you're taking your medications just like your doctor told you. One for arthritis, one for your heart, maybe something for reflux. Everything feels fine until suddenly it's not. Out of nowhere, you're dealing with strange bruises, extreme fatigue, maybe even a dangerous fall. And the worst part, it might not be your age, it could be your medications working against each other silently. In this video, we're revealing 3 common drug combinations that can actually make arthritis symptoms worse, especially for seniors. These aren't obscure drugs. They're medications you or someone you love may be taking right now. And yes, this information has been carefully fact-checked by licensed health professionals, so you can trust every word you hear. We're talking about the hidden dangers your doctor may not have warned you about and what you can do to protect yourself starting today. And stick around because near the end of this video, I'll share one powerful tip that could not only help reduce your pain but also make your medications work better together safely. It's something most people never hear about. Let's get started. Your health could depend on it. Number 1. NSAIDs, that's drugs like ibuprofen or naproxen mixed with blood pressure medications, especially ACE inhibitors or ARBs. Now let's talk about this in a way that really makes sense. Picture this, you're a senior dealing with chronic joint pain. 0. Naturally, you reach for something that helps. And what's sitting right there in your medicine cabinet? Ibuprofen, maybe naproxen. They're over the counter, they're easy to get, and hey, they usually work. At least for a little while. But here's where it gets tricky. You're probably also taking something for your blood pressure. Medications like lisinopril, enalapril, or losartan, all common, effective drugs that help protect your heart and kidneys and keep your numbers in check. These are ACE inhibitors and ARBs. Doctors love prescribing them because they work well, especially for people over 50. Now here's the problem. When you combine NSAIDs with ACE inhibitors or ARBs, you could be putting your kidneys in a really tough spot. And that's something most people never realize until it's too late. Let me explain why this combo matters. NSAIDs work by reducing inflammation. That's great for arthritis, right? But they also constrict blood vessels that lead to the kidneys. That means less blood and less oxygen gets to your kidneys while you're on them. Now, on the flip side, ACE inhibitors and ARBs actually dilate blood vessels. They open them up, which is part of how they lower blood pressure. So now you've got one drug that's narrowing the flow to your kidneys and another that's opening the exit. It's like turning down the water coming into a tank while opening the drain at the bottom. Sooner or later, that tank runs low. In your body, that tank is your kidney. And if your kidneys aren't getting enough blood, they can't filter waste effectively. Over time, this stress can lead to kidney damage, especially if you're taking these medications daily or long-term. And here's the kicker, the damage often happens silently. You may not feel it. No sharp pain. No red warning light. Just a slow decline that can creep up without warning until your doctor says, your kidney numbers don't look good. And if you've already got mild kidney disease, which many seniors do without even knowing, this combo can speed up the problem dramatically. Now, let's talk about arthritis itself. Taking NSAIDs might give you a few hours or a day of relief. But is that short-term comfort worth risking your kidney health and making your arthritis even worse in the long run? Yes, it can make arthritis worse. How? Well, if your kidneys become less effective, inflammation builds up in the body. Your joints might swell more, your fatigue might increase, and that stiffness you hate in the morning, it might last longer. So while you're trying to treat one problem, you may be quietly fueling another. And yet this combo is so common. Why? Because NSAIDs are everywhere. And most of us don't think twice about grabbing a few pills when our knees ache. After all, they're safe, right? Over the counter, trusted. But safe doesn't always mean safe for you. Especially when you're over 60, your body handles medications differently. Your kidneys are more vulnerable. Your circulation changes. Your body becomes more sensitive to interactions. What used to work in your 30s or 40s might be dangerous now, even if it never gave you problems before. So what can you do? First, don't panic. Just because you've used NSAIDs doesn't mean you're doomed. But it does mean you should start asking smarter questions. If you're taking ACE inhibitors like lisinopril or ARBs like losartan, talk to your doctor before using NSAIDs regularly. Even the occasional ibuprofen should be discussed, especially if you're on blood pressure meds or have any kidney concerns. Your doctor might suggest safer alternatives. Sometimes acetaminophen, like Tylenol, may be a better option for pain, though even that needs monitoring. In some cases, physical therapy, gentle stretching, or natural anti-inflammatory foods can help you manage arthritis without risking your kidneys. Also, don't forget hydration. Staying well hydrated helps protect your kidneys too. And make sure you're getting your kidney function tested regularly. Simple blood and urine tests can catch changes early. And here's the bigger message: it's not just about the medications. It's about how they work together in your body. Because at your age, your body is a delicate balance. Each drug you take interacts with others. And that's why it's so important to look at the full picture, not just individual pills. So the next time you're reaching for that ibuprofen bottle, just pause. Think about your blood pressure meds. Think about your kidneys. Think about the long game, not just the quick fix. Because protecting your joints isn't just about masking the pain. It's about protecting the organs that keep you moving, living, and feeling well. Your health is worth that second thought. Number 2. Corticosteroids like Prednisone combined with anticoagulants such as Warfarin. Now, this is a drug combo that might not seem dangerous at first glance, especially if your doctor prescribed both. But when used together, they can quietly increase your risk of internal bleeding, especially if you're a senior already dealing with arthritis, inflammation, or a heart condition. Let's break it down in a way that's easy to understand. So prednisone, that's a corticosteroid. Doctors often use it to tame inflammation. Maybe you were prescribed it for a nasty arthritis flare-up, a respiratory issue, or something like polymyalgia. When the pain gets intense and swelling takes over your joints, prednisone can feel like a miracle. It kicks in fast and really calms things down. But here's the thing: prednisone doesn't just reduce inflammation. It also weakens the lining of your stomach and digestive tract. Over time, it makes the blood vessels a bit more fragile and can raise your blood pressure too. So while it's helping you move without pain, it might be putting stress on the inside. Now let's bring Warfarin into the picture. Warfarin is an anticoagulant, often called a blood thinner, and it's prescribed to many seniors to prevent strokes or blood clots. If you've got atrial fibrillation, a history of deep vein thrombosis, or even a mechanical heart valve, warfarin might be a part of your daily routine. It does an important job. It helps prevent clots from forming in dangerous places, like your brain, lungs, or legs. But it works by slowing down your blood's ability to clot, meaning if you start bleeding internally, your body has a harder time stopping it. So here's where it gets dangerous. When you combine prednisone with warfarin, the risk of internal bleeding goes way up. Why? Because prednisone can thin out the stomach lining and weaken tissues, while warfarin reduces your ability to form clots. It's a 1-2 punch that your body just isn't equipped to handle, especially if you're over 60 and maybe already have a few other health concerns. And the bleeding isn't always obvious. This isn't like cutting your finger and seeing blood. Internal bleeding often starts silently. It can show up as dark, tarry stools, bruising that spreads fast, or feeling lightheaded or unusually tired. Some people notice blood in their urine. Others feel totally fine until one day they suddenly don't. That's the scariest part. Now, does this mean these drugs should never be taken together? Not necessarily. Sometimes, doctors prescribe them together very carefully, but they monitor you closely. They'll check your INR levels if you're on warfarin, which is a test to see how long it takes your blood to clot. They'll also check your blood pressure, ask about bruising, and sometimes recommend stomach protectants like proton pump inhibitors to reduce bleeding risk. But you know what happens all too often? People are prescribed prednisone for a few days or weeks, say, during an arthritis flare-up, but no one adjusts their warfarin dose. Or they don't get follow-up blood work. Or worse, the doctor doesn't even realize the patient is taking warfarin because it's being managed by another specialist. That's why you have to be the one to connect the dots. If you're on warfarin and your doctor gives you prednisone even for a short time, speak up. Say, "Hey, I'm on a blood thinner. Is it safe to combine these?" That one question can make a huge difference. And here's another thing to think about. Prednisone can also increase your risk of bone thinning, known as osteoporosis. Combine that with the bleeding risk from warfarin, and if you fall something as simple as a trip on the rug, you're facing a double danger. But you might fracture a bone and bleed internally at the same time. So yes, the combo is powerful and not always in a good way. But don't feel helpless. This is about empowerment, not fear. Here's what you can do. Know your meds. Keep a list of everything you're on: prescription, over-the-counter, and supplements, and bring it to every appointment. Ask questions. No question is silly when it comes to your health. Will this interact with my blood thinner? Is a smart and necessary one. Watch for warning signs. Unexplained bruises, black stools, pink urine, or dizziness could be your body's way of waving a red flag. Get regular blood tests. Your doctor can adjust your warfarin dose based on how your body is responding. Consider alternatives. If inflammation is chronic, ask if there are other ways to manage it, like low-dose NSAIDs under supervision, physical therapy, anti-inflammatory foods, or safer long-term options. Remember, your body changes with age. What worked when you were 40 might not be safe now at 70. Your liver processes drugs slower. Your stomach lining is thinner. Your bones are more brittle. And your blood chemistry is more sensitive. But knowledge is power. By understanding these risks, you're already doing more than most. You're protecting yourself, you're stepping up for your health, and you're giving yourself the best shot at living well with fewer surprises along the way. So before you reach for that steroid prescription while on Warfarin, pause, ask, double-check, your future self will thank you. Number 3. Methotrexate, often used for arthritis combined with proton pump inhibitors or PPIs like Omeprazole. Okay, this one might surprise you because both of these medications are extremely common. In fact, you or someone close to you might be taking both right now and have no idea they can interact in a dangerous way. So let's take a closer look together. If you've been living with rheumatoid arthritis or psoriasis, you've probably heard of methotrexate. It's not just a pain reliever, it's what we call a disease-modifying drug. That means it doesn't just mask the symptoms, it actually helps slow down the progression of the disease. Pretty powerful, right? Methotrexate works by calming down your overactive immune system. In conditions like RA, your immune system mistakenly attacks your joints, and that leads to all the swelling, stiffness, and pain. Methotrexate says HOA slow down and helps reduce that attack so your body stops hurting itself. But here's the thing, because it's such a powerful drug, it has to be handled carefully. Your body, especially your liver and kidneys, are responsible for breaking methotrexate down and getting it out of your system. And when things go smoothly, the drug does its job and leaves your body without much trouble. Now let's talk about PPI's proton pump inhibitors. Drugs like Omeprazole, esomeprazole, or pantoprazole. You've probably taken one if you've had acid reflux, heartburn, or GERD. Maybe your doctor gave it to you alongside NSAIDs to protect your stomach, especially if you're dealing with arthritis or other chronic pain. They're considered pretty safe. They're available over the counter. And for many people, they work like a charm. But here's the problem. When you combine PIs with methotrexate, especially at higher doses, you may unintentionally trap the methotrexate in your body for too long. Let me explain. Normally, methotrexate is processed and cleared through your kidneys. But when you're taking PIs, they can interfere with kidney function, specifically with the way methotrexate is eliminated. It's like closing off the exit door while the drug is still active inside you. So instead of being flushed out, methotrexate starts to build up in your bloodstream. And that's where the trouble begins. High levels of methotrexate in your body can lead to toxicity, and that can affect multiple organs. You might experience mouth sores, nausea, fatigue, or even breathing problems. In more severe cases, it can cause liver damage, kidney failure, or bone marrow suppression, which affects your ability to produce healthy blood cells. And here's what's really concerning: this interaction doesn't happen with just a huge dose. It can happen even at moderate levels, especially in older adults whose kidney function is already a little slower due to age. So you might be taking what feels like a safe combo, methotrexate for arthritis and Omeprazole for your heartburn, and yet, over time, it can quietly start doing harm in the background. And most people don't even know it. Doctors may not always mention it, and pharmacists might miss the connection unless they're specifically looking out for it. Because both drugs are so commonly prescribed and they're used in different specialties, it's easy for this interaction to slip through the cracks. But not for you, because now you know. So what can you do? First of all, don't panic. If you're on this combination, don't stop your medications suddenly. That can do more harm than good. But it's absolutely worth a conversation with your doctor. You can ask something like, "I've heard that PPIs can interfere with methotrexate. Is this something we should monitor?" That one sentence can make a big difference. Your doctor might adjust the timing of your doses, lower the methotrexate dose, or even suggest switching from omeprazole to another type of acid reducer that's less likely to cause problems like an H2 blocker such as famotidine. Also ask if you need regular blood tests. These tests can check your liver enzymes, kidney function, and blood counts to make sure everything's staying in the safe range. And if you ever start noticing unusual symptoms like extreme fatigue, mouth ulcers, fever, or feeling winded after small activities, those are signs to call your healthcare provider right away. Don't ignore them. Remember, your body isn't the same at 65 or 75 as it was at 35. Even if a medication worked fine years ago, your kidneys might not clear it as efficiently now. And that makes drug interactions more important than ever to pay attention to. The good news? You're not powerless. In fact, just by learning about this, you're already taking better care of yourself than most. You're being proactive, you're being smart, and you're not leaving your health up to chance. So the next time you take your meds, take a second to think about how they work together, not just on their own. Methotrexate and omeprazole might both be helpful, but only if they're used with care. Your health is worth that extra awareness. Summary. So let's quickly recap what we've learned today. We uncovered 3 drug combinations that can quietly make arthritis worse, especially for seniors. These are everyday meds like NSAIDs, corticosteroids, blood pressure medications, anticoagulants, methotrexate, and acid reducers like omeprazole. On their own, they can be helpful, but when combined, they can put serious stress on your body, increasing your risk of internal bleeding, kidney damage, or toxic buildup. And remember, none of this is meant to scare you, it's about awareness and empowerment. The more you understand your medications, the more control you have over your health. You deserve to feel confident, not confused, about what you're taking. So if any of these combinations sound familiar, talk to your doctor or pharmacist. Bring it up. Ask questions. Your voice matters, and your life might depend on it. And if you found this video helpful, don't keep it to yourself. Share it with someone you care about. So many seniors are unknowingly at risk, and this could be the wake-up call they need. Make sure to like, subscribe, and hit the bell icon so you don't miss any of our upcoming videos, especially the next one, where we'll share some natural arthritis relief tips your doctor probably hasn't told you. Thanks for watching, and most importantly, keep taking care of yourself. You're worth it.